Hi, everyone, and welcome to the Muslim Sex Podcast. Thank you so much for tuning in. I really appreciate your patronage, and I would love it if you could leave me a 5-star review because that really helps me. And if you could like and share this episode with somebody that you know that may benefit, your friend, your colleague, anyone, I'd really love you to share this podcast, especially if you find value in the Muslim Sex Podcast. Also, I'd love for you to subscribe to my YouTube channel and follow me on all my social media. Also, as you probably know, if you've been listening to this podcast, is that I have a practice that is now open in Chappaqua, New York. I see patients for menopause and sexual health, as well as regular gynecology. So if you are looking for a gynecologist that actually spends time with you, that has time to listen to you, then I would invite you to come and see me in my practice, and I'd be more than happy to take care of you. So make sure if you live in the New York area, or even if you don't, come and see me in my office. I'd love to meet you. And also, last but not least, is that I am hosting again my retreat in Morocco for 2025. So if you are looking for a gift for a family member, a friend, yourself, make sure you take a look at our retreat, the Love and Nourish retreat. It will be held September 19th through the 26th, 2025. Again, this year in Morocco, we will be visiting the same towns. We will be in Marrakesh and Essaouira. And as always, we will be providing information and lectures on menopause, perimenopause, nutrition, and also going for cooking classes as well as excursions. So don't miss out. I know a lot of people were sad when they missed out this past year on the Morocco retreat. So make sure that you go and visit the Love and Nourish retreat hosted by Caria Retreats. And now onto the episode. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf, and this episode is everything you need to know about urology and all of the common things that happen when you have any type of urologic complaints. But before we get into it, a few things that I want to make clear, as I always do, this is not any type of medical advice. So if you have any questions about urology or anything else medically related, make sure that you speak with your healthcare provider. And of course, this is not any advice on religion. So if you have any questions about your religion, please speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So I am super duper excited to have on with me today, Dr. Fenwa Milhouse. Woohoo! Welcome. And thank you so much for making the time. I know you are a super busy lady, physician working in the Chicago area, but I'm so grateful that you made time for us today. So thank you for being on.
Thank you, Dr. Ludi. It's been a pleasure. I know we've been working on pinning down this time and this day, going back and forth. So it's a pleasure. Thank you for even allowing me to grace your audience presence, and let's get into it. Yeah.
Yes, well, we are the lucky ones. So I, of course, like to do a little bit of background research on my podcast guests. And so I was doing my research really on your website about you. And I love your story. So I'd love for you to share your story with our viewers and our listeners because so much of what you stated about why you went into urology really resonated with me. But I'd love to hear it from you.
Yeah, sure. So I'm originally from Nigeria, grew up in the United States. I'm an immigrant myself. And, always knew I wanted to be in medicine. I wanted to help people. And so I knew I wanted to be a doctor, got to medical school, learned early on in medical school. When I got to medical school, I didn't know what a urologist was. Okay. And I'll never forget the day a friend of mine said, we were all talking about, this was like the first week in intern year. We were talking about, hey, what do you want to do when you grow up? One of those conversations. Oh, I think I want to be ortho. Or I think I want to be, OB-GYN. Oh, I think I want to be derm, and I'm like, I don't know. But one of the people in the group said, oh, I want to be a urologist. One of the dudes in the group, I want to be a urologist. And I remember thinking, I don't even know what that is. I don't even know what they
Same,
do.
same. I didn't know what that was
I
either.
don't
So
know what that is. So I went back to my apartment, got on it, Googled it, and I was like, oh, this sounds like the male gynecologist.
right.
And like the male version of gynecology, it's like for men by men, you know. If you Google like urology, you'll get a picture of probably an older white gentleman. And they were surgery specialists. And I had no thought in my brain that I could be a surgeon. That wasn't like something that I saw myself as. And I certainly didn't see myself as a urologist. I mean, it just wasn't, I wasn't represented in what I saw. So I crossed it off my list, and that was that. And so how did I become this urologist? You know, so what changed? Well, a year and a half into medical school, we're sitting down for this lecture, and we're about to get this urology lecture. And I'm packing my bags up to leave the lecture because we could skip out, you know. And I already had crossed urology off my list. So why was I going to waste, you know, 30, 45 an hour of my time? So as I'm getting my stuff together, my friend like elbows me, another black medical student. She's like, wait, wait, look who the speaker is. And I turn, and the urologist who's about to speak is a black woman. And I'm like, they make those? Like, I'm like,
Right? They come in that color. Can I have
come in
that?
that size. Yeah, exactly. Come in that color and that flavor. Like what? You know, and I was blown away, like
Yeah.
just jaw on the floor. And so two things. One is if we ever had a black lecturer, we weren't about we even if we were like bored and like really didn't care about what they were saying, we were not going to be the ones to like walk out on that black lecturer. So I wasn't about to, you know, be because there's only 10 of us black students in medical
Yeah.
school. So you can see,
Right.
you know, in this whole medical class. And so I was like, okay, let me put my stuff back down. But moreover, I really was like now totally intrigued at this field, you know, because I saw myself like for the first time. And that like began this like full 180, like, oh, what is this urology you speak of? I want to know all about this specialty. I, you know, started shadowing her and started shadowing other urologists. And I was like, this I can do. This, I like this type of surgery. I think I can be a surgeon and I think I can help people. I found my niche, I found my home. And really, truly, I love sharing that story. And you can hear like the passion and excitement in my voice because it was a one of those life defining moments. Like if I did not have that 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 exposure, you know, just seeing her, this doctor that looked like me, I would, you know, would have a very different pathway. And I truly believe I found my calling. And I know that representation is so critical and so important and is life changing.
I hear you, and I'm smiling the whole time because I'm thinking back to when I was, when I was looking into OBGYN and I was trying to figure out what I wanted to do. And I was, I did OB because same thing. I didn't see women that looked like me, in positions of power. And so actually when I was interviewing at different places for a residency spot in OBGYN, I picked my residency because the woman that was the residency director at that time was a Black woman
Yeah,
that, was really strong and intelligent. And I was like, wow, I love her.
mhm,
Like she
mhm,
is,
yeah,
like my role model. And, it was because it was a woman of color. And
yeah,
I just was like, this was the first, most of the other places where I had interviewed, they were all, white gentlemen that were the program directors, the residency
mhm,
directors and stuff like that. And she was the first woman of color that I saw. And I was like, oh my God, I have to be in this residency. She's amazing. And she
yeah,
was like a second mom to me. So I really hear you. And you're absolutely right. Like representation is so important and it
yeah.
matters so much. And when somebody can see themselves in you, then that really changes their life, just as it changed your life. So that's amazing. I love that story. And I'm
Thank
so glad
you.
you shared it with us.
Yeah,
I'd love to know more about. So you had that TLC episode about
yeah,
the doctor down there episode
yes.
that you had, and so I
Doctor
was,
down below,
ooh, doctor down below.
down
Yes,
below. It should have been
yes,
doctor
and
down there, but doctor down below is what they went with. So
down there, yeah, that will work too, right?
yeah,
But was that a one time episode? Was that a series? Was that? What was
Oh,
it? Tell me more.
you want me to give you the tea, child. Okay. So
Yeah.
for everybody who's listening, who's like, what are they talking about? If you watch TLC at all, hopefully you've seen this episode. It's one episode so far. Doctor Down Below. It's me as a urologist. It's like it's one of those Dr. Pimple Popper styled shows, and it's really educational, really entertaining, and they have to they're showing genitalia, so it's blurred, but you can get a good sense. Like they blur minimally, in my opinion. They really tried to make sure you understood what we were looking at. In the episode, there's a guy who has a piercing in his penis, and the piercing now has caused this hole that he pees out of in his penis that
Oh
he doesn't want
man.
to pee out of anymore. So you see
Wow.
that, you see
The
my
urine coming out.
methylene blue that I squirted in his penis, coming out the other hole. They show that. Also in the episode, there's this lady who has this looks like a testicle growing off of her labia that I removed. So anyway, very entertaining, very well done. So to your question, that came organically. That came organically. I was just being myself on Instagram, which I had embraced by now. I started off Instagram I'm going to be prim and proper and talk about urology, and that quickly was okay, this is not me. Who am I fooling?
I was gonna say, prim and proper. Every time I see you on Instagram, you're dancing, you're shaking your booty. I'm like,
you're like, when was she prim and proper? Exactly.
no. When was that? Let me go back. I want to go back.
You gotta go back, way back. You gotta go way back. It lasted for a month, maybe. So that was
Okay.
who am I feeling? Let me just be myself. So I was just myself, and this talent manager person and plugged me into a production team, and they're like, we think you'd make a great doctor, blah blah blah. We think people would love you. The only catch is because of what you do. And I laughed. I said, I look at dicks and vaginas all day. That's the only catch. The only catch is trying to relay what you do in a way that TV will allow. And so what TLC loved, I had to give them footage. It was a long process. And throughout the whole process, I was like, I don't think this is going to work. But I'm just going to go for the ride. But TLC loved it. They just knew they had to blur it heavily, and they said, okay, we want to approve you for a season, but we just are going to show one episode and see how the audience likes it, what the audience response is, and then decide to pilot a whole season depending on that. So when they did that aired in April of 2023. It did really, really well. It was almost 1 million viewers.
Amazing.
It followed Dr. Pimple Popper, and people loved it. The ratings, the reviews were all great. The unfortunate time period that it landed was at this time where now things started having a major shift in television and movies and striking and, and that sort of stuff. And so right now, really, TLC, if you haven't kind of noticed, they have really pulled away from almost all their doctor shows. And are pausing them, if you will, perpetually until further notice. And so we'll see what happens. But it was, I think they did a fabulous job, the production team. They did a fabulous job. And I think more people would love to see stuff like that because it was really cool things. As you know, being a specialist who it works down there, it's down there is super mystified for everybody, so we have a lot to teach the public.
We do, and that's fantastic. Well, congratulations on that episode. It sounds fantastic, and I'm gonna have to catch up on that one, so that sounds amazing. I'd love to know, what are the things that you typically see in the office? And I know there's so much, right? So I'm sure you could get into a gazillion things, but let's say maybe female specific. What are the things that women are coming to you for?
Oh, goodness. So as a urologist, first of all, urologists do see women. Anybody who makes urine, who, empties their bladder is fair game for a urologist to see. I also have an extra notch in that I did a fellowship in female pelvic pelvic floor reconstruction, genital
Oh,
urinary
wow.
reconstruction.
Okay.
So
Mhm.
I do see probably a lot more women than the average urologist sees. Okay.
Got it.
So
Yeah.
in my practice, I can see women who have any number of vulva vaginal anatomic problems, meaning they've got something sticking out of their vagina. Okay. Like prolapse, pelvic organ prolapse,
Mm. Mhm.
where our bladders or uteruses or whatever's, fall out. I do that a lot. I see other anatomic things. I'll see like lumps and bumps on the vulva. So vulva cyst, urethral diverticulums, that kind of stuff. I treat, obviously, as a urologist, I treat incontinence. So a very common thing women see me for is I can't hold my urine for
Okay.
whatever X amount of reason. So that's very common. Um, and what kind of is now more common in my practice that resulted after like kind of like growth and shifting is I treat a lot of female sexual dysfunction.
Mm. Okay.
That's
Yeah.
an area, yeah, that's an area. This is the Muslim sex podcast, so we got to talk about
Of
sex.
course.
Um,
Absolutely.
yeah, that is something that I did not anticipate I was going to be doing. I'll be honest with you.
Mm.
When I got into urology, even when I did the fellowship, I didn't do the fellowship thinking this is the fellowship that I want to help women have sex, you know, that have X amount of what sexual dysfunction. I did not even, that wasn't in my brain. But as you know, being a gynecologist yourself, you realize that no one is doing this,
Yeah.
right? No one is owning this female sexual dysfunction. Now things are changing, thank God, but no one's owning it. And so I was the urologist seeing all these women for other things. And they're like, well, you're seeing me for all these other personal related stuff. Can you help me with sex?
Yeah.
And I was seeing their husbands, let's say, or seeing the men and helping them with sex. Because as a urologist, we are very good at men's sexual dysfunction, right? ED, low libido, premature ejaculation, could do that really well. And I was like, whoa, okay, I guess. Like, don't you have somebody else who can do that? No, we don't, Dr. Milhouse. Can you help us? And I felt like, well, damn, I want to help them. You know what I'm saying? And so I became, um, I became a learner of, again, like I'm going to learn how to work this up and treat and offer treatments and, be a part of this growing community of specialists in female sexual medicine. And so that is a very common part of my practice now.
I love it. I love it. And, I think that what I love about urology, and I will, I agree with you 100% when you said, you used to think that urology was for men by men, because that's exactly what I had in my head. And when I
Mhm.
started seeing more and more urologists, female urologists, it kind of blew my mind. I mean, it sounds kind of stupid, but it did, because I was
So
like,
much.
oh, right, you can have a woman urologist. That makes sense. Everyone
Yeah,
pees. That's right. Because
yeah,
I would think like, oh, urogyne, right? Like if I have an
yeah,
issue, I'll go to a urogynecologist,
yeah,
and men go to urologists, whatever. So
yeah,
I agree with you. And I think that, female sexual dysfunction comes up a lot. And what I
yeah.
love about urology actually is that you get to see both, right? You get to see the
Yes,
husband, if the husband is your patient, and then you can even see
yes.
the wife, and you get to see that couple dynamic, which, I recently shadowed Rachel Rubin, and that was something that I saw. And I was like, this is fascinating, because in gynecology, we don't see that, right? We only see the women. And I don't know what's going on with the man. So he may be having erectile dysfunction, premature ejaculation, all of these things, but I'm not seeing it. I'm not dealing with it. He has to go to somebody else. I only see the woman. But that's what I love about urology, is that you get to see that couple dynamic. So when you're able to fix both, you really help that marriage and help that couple stay together. So I think that's fantastic.
I love, yes, you bring up such a great point, and I will say, and I love that about my specialty. And I'll give you two quick examples of how exactly this. So, one example is I saw an older couple. Okay. He had prostate cancer that was treated. She's well postmenopausal. I think they were, let's just say they were in their 70s. Okay. And he was now considering what we call he had erectile dysfunction after the prostate surgery, after his removal, which is unfortunately common enough. And he was now determined, he had now decided he was going to get a surgically placed penile prosthesis, which is a device that we can put in, okay, to get a firm penis. All right. He was going to undergo this surgery to put this device in. Problem is, he loved his wife, but they had not been intimate in many, many years.
Mm.
She had this point, it was painful. Part of it was he couldn't get erect. It's been painful. So they kind of just stopped trying, right? And so now he's like, I want to get this device, but like, I don't want to get this device if I can't use it
Right.
on the one person I love. So I need her.
Yes.
We need to get treated, right? And she wanted to engage with him too now. And so I like literally saw them together,
Amazing.
him and, her,
Yeah.
and
Yeah.
so I assessed her and I was like, we've got, fair amount of work to do here on this vulva and the vagina, because it wasn't about to take anything. It needed a lot of TLC to
Right.
be able to, enjoy penetration again. So working heavily on her, I already put her on vaginal hormones. Okay. And we're doing vaginal dilators and pelvic floor physical therapy and all these things to get her, working on her and working on him. But can you imagine if this was separate, and it's most of the time
Right.
separate, he gets
Right.
this penile prosthesis. Then he gets his surgery and he's like, yeah, doc, it's successful, but like, I'm not really happy with it. And
Yeah.
I would, as the urologist, I'm like, I put this device in you. How are you not happy with it? Well, you have to understand the whole dynamic,
Yes.
right?
Yes.
To understand the whole dynamic.
Absolutely.
Second quick example, this lady I treated for low libido, had low libido. She was like in her late 40s, put her late 40s, early 50s, part of the treatment, we put her on testosterone. So I'm giving her testosterone replacement therapy. She's loving it. She feels like herself again in multiple ways, but her libido is like back. And I'm like, how are you? Well, my libido's back, but like, ain't nothing happening. And I'm like, why? Or what's he's like, she told me, she's like, my husband has erectile dysfunction. He's like in denial.
Yeah.
So we like, I remember she was like, can you please talk to him? He's in the waiting room. Can you please?
That's awesome. That's great. That's great. I love it.
So anyway, I'm working with both of them. Yeah.
I love that. See, this is how you really are changing like couples' lives. And that's so fantastic. I see that when I do my sex coaching, I get to see both the husband and the wife. But, in general, I'm dealing mostly with women as a gynecologist. So I don't get to see that couple dynamic. And just to your point, what you just said about, with a male partner having erectile dysfunction, I have a patient who, she's in her late 50s, and same thing. She is, hasn't been able to have sex. She has lichen sclerosis. So we're dealing with that. I'm treating her, and she's using vaginal dilators, going to pelvic floor therapist, all of those things. But now she feels better. But her husband has erectile dysfunction because of all the years she was having painful sex. She couldn't have sex. So he developed this, right? So now he has this thought that he's always going to hurt her, that she's going to have pain. And so he has this horrible erectile dysfunction. And she said that now that when they try, she's like, it's more uncomfortable because he's, not able to have an erection. And she's like, she's like, okay, forget it. We got to sort this out because it's not working anymore. So
sex therapy.
Yeah, exactly. 100%. That's therapy because, now she's like, he's taking Viagra, he's taking Cialis, blah, blah, blah. But I think he still has so many of those thoughts, right? That he's going to be causing her pain, that he's got to work through that. And you're exactly right. He needs to go to a sex therapist or a sex coaching or something like that, where he can work on those thoughts, where he has to change them from he's causing her pain, that now that, he can bring her pleasure if she wants it, to help with his erection, because now he's just so worried that he can't get that out of his head.
Yeah. Yeah. And they can go slowly too, go slowly and reacquaint themselves to like genital touch from one another. Yeah. 100%. Oh gosh, please. I'm like, I hear stories like that and I'm like, oh my gosh, I'm invested in this. Now I
Yeah.
must see them through. Like,
Yeah, yeah, absolutely. And
I want this for them. Yeah.
yes, and you know, the just what you said right now is that you said, they need to get reacquainted with
Yes.
each other. And so the modality that I tell them is the modality that I absolutely love is sensate focus.
Yeah.
And I had Linda Weiner on this podcast, and she, wrote that book. First, that it was developed by Masters and Johnson, the whole idea of sensate focus. But then she also wrote a book and a handbook and stuff like that. So she was at Ishwish, and so she came on my podcast and we talked about it. And just exactly what you're saying, they have to get reacquainted. And how do you do that, right? So you do the sensate focus where you touch just for the sake of touching, just so that you can feel the texture, the taste, the pressure in that. And so then you really focus on your senses. Then you're not focused on the end goal, right? There's no like you have to achieve an erection or you have to orgasm or anything like that. But instead, you're just so focused on the sensations and you just let happen whatever happens. And that's why I love it so much. It's so great for people that have had trauma or abuse, but also those that haven't had sex in so long that they have to get reacquainted with each other before they can be that intimate.
Oh, wow.
Yeah. Yeah.
I love the work that you're doing. You must
Yeah.
like see and change so many different lives and being able
Yeah.
to do the coaching part, but then also being, the medical, adding the medical side of things. That's true.
Yeah.
Yeah.
Yeah, I love it. And I'm actually writing a book about it too.
You
It's
should.
coming out hopefully, yeah, hopefully by the end of this year, but it's going to be great. And so also I talked to them about Lori Brado's work, which is mindfulness. So, she has that book, Better Sex or
Yep.
Mindfulness, and she now has an app as well. And so we talk about that mindfulness so that because I feel like people are so much in their heads that they can't get out of their heads to just experience the touch and the sensations and just give themselves permission. So once they give themselves permission to really just enjoy what they're doing and just focus on that, then everything else just follows.
Well, I think people go into sexual encounters with, again, like, I need to achieve XYZ. You know what I'm
Yes.
saying? And put a lot of pressure on themselves or their partners. Well, I hope this feels good. I hope I come. I hope he comes. I hope she comes. I hope, you know what I'm saying? Da, 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 da. And we have to turn that off and kind of enjoy the journey. I tell patients, like, it's like the kid in the backseat that's like, are we there yet? Are we there yet? Are we there yet? Are we there yet? Like, just don't, like, the more you like are focused on the destination, the further away it feels it gets. It's harder to, you know what I'm saying? And the more you just kind of like tune into what your body's experiencing, then it's like, oh wow, well, once I'm actually tuned into what my body's experiencing, like, okay, well, dang, all right, that feels good. Oh, I like that, like that. You know what I'm saying? And there's no, and if you end an orgasm, cool. But if you don't, and the ride is still enjoyable, you guys, you still enjoyed this intimate moment together. So
Absolutely. And you're so
yeah.
right. Like Emily Nagoski says, she says, pleasure is the measure, right? So are you really enjoying yourself? If you are experiencing pleasure, then that's really it. That's the main goal, right? It doesn't have to be orgasm. It doesn't have to be, that both of you orgasm at the same time or whatever it is, right? Whatever your end goal is, it's just, are you enjoying yourself? Is it fun? Is it playful? Is it satisfying? Does it connect you? Is it
Yeah.
emotion? Is it bringing you together emotionally? Right. And so that I find is really, really important. I'd love to know more about kind of, what you see in the office. So I know you talked about female sexual dysfunction. You talked, do women come for you also for orgasm? I assume they probably do, right? For
Yes.
orgasm as
Yeah.
well as
Yeah.
everything else.
I treat all sexual dysfunction in men and women. For
Yeah.
women, yes. Probably the top sexual complaint for women is loss of desire, low
Yes.
desire,
Yes.
followed by painful penetration, or pain with
Yeah.
sex. And then less common, but out there, are orgasm dysfunctions and issues, primary and secondary anorgasmia, meaning I don't orgasm or I lack pleasure. Okay, anhedonia. The primary one where they've never had an orgasm, never had pleasure, as you know, can be, challenging. But I love a challenge. It's a lot of, it's basically, well, everybody gets a sex therapist. Like in my perfect world, everybody, and I'm including the man who's like, I just have ED, give me some drugs. Nah,
Yeah.
you get sex therapy too. Okay.
Yeah. That's right.
Because your
That's right.
brain is already is messed up too now, because you couldn't get it up when you wanted to a couple times, and now you don't feel as confident, and da 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 da. So in my perfect world, everybody would get sex and will go to it. I mean, I talk about sex therapists all the time, all the
Yeah.
time. So they're
Yeah.
all getting sex therapists, but I prescribe a lot of like masturbation homework, as I put it, a lot of vibratory stimulation homework. So I'm a very pro toys, pro vibrators.
Right.
You need, particularly for my female patients, and some erotica homework too. And I basically say you need to know what feels good for you, as before you can expect somebody else to make you feel good. Okay.
Yes. Yes.
Um, for men, most common things sexually that I see: erectile dysfunction. Um, and then erectile dysfunction number one. After that, probably a tie between premature ejaculation, so ejaculating too soon, and some low libido. Men rarely have delayed or absent orgasm, but we do see that delayed ejaculation slash orgasm or absent orgasm. Usually it's really a lot of psychosocial issues, or a medication side effect, or like a nerve related to something. And then like the rare like sexual pain in men. So those are things, but by far most common for men is, having to help them get erections.
Yeah, I'm sure. And so, I love that. I just love the fact that you're able to work with both people. I just think that that's so fantastic. So, what do you tell your, so I've had Dr. Kelly Kasperson on here on this podcast before, and, she talked about erectile dysfunction. She talked about premature ejaculation.
Yeah.
What do you tell, so this podcast is actually a global podcast, which I'm so grateful for. It has close to 100,000 downloads. And outside of the
Amazing.
US, it has India actually is the biggest country that listens to it. And I think it's because it's a free podcast and it's just, just information for people.
Yeah.
So for those individuals that may be listening that either have partners, or maybe perhaps it's, somebody that was born with a penis that is wondering about premature ejaculation and erectile dysfunction, what are the common treatments that you tell them? I know it's like a big topic, and, you
Yeah.
probably don't have time to get into all of it, but what are
Yeah.
like some things that you recommend for people that are suffering through that?
So erectile dysfunction is like, in my opinion, one of the like easiest things in urology that we know how to
Mm,
treat. Like we have a lot of good options. At the end of the day, I like to tell patients, at the end of the day, I can probably get you an erect or stiff penis. Okay. All right. The first thing I do is comb through their history very thoroughly. I tell them I'm going to get very nosy. I'm asking them how are their morning erections? Do they have them or do they not? Do they masturbate, and how's their erectile quality then? How do they feel about their partners? Are they attracted to their partners? Is there relationship issues? Do they smoke? Do they do drugs? Do they drink? How much do they drink? Do they exercise? How often do they exercise? All of these things I'm asking to get a sense of like, is this more psychogenic or more organic erectile dysfunction? Psychogenic is the mechanics are there, blood flow is there, but there's some sort of psychosocial issue that's blocking the brain and the penis from alignment. Okay. You and your wife are like completely not on the same page. I had a person who finally admitted to myself that they were completely unattracted to their spouse. That
yeah.
and I was like, well, that's a big problem. Like, how are we going to get over that? Okay, or they have a lot of performance anxiety. Like that's a common thing. I'm seeing a lot of young men with ED, and I think it's a lot of anxiety in this younger population, right? So that's examples of psychogenic ED. Organic ED is more common. It's kind of the medical ED, if you will. Like the blood flow is weak. Okay, you've got the cycle. The cycle stuff is not really maybe not a factor, but like the blood flow is weak, the arterial inflow is low, or there's a venous leak from the penis. And so these patients, common things we'll see is, yeah, they lack morning erections because those erections are not under our like consciousness. And so with psychogenic ED patients that have good blood flow, they're going to get them. But with the organic, they'll be minimal or absent. Okay. And so depending on what I think it is, obviously will depend on how much I recommend sex therapy. Now, I just said everybody gets sex therapy, right? So organic ones get it too. But if they're really psychogenic, I'm like really pushing, right? Because that's, needs to be worked on. But we have medications, right? Even for my psychogenic ED that are maybe performance anxiety, young man who comes in with ED that has probably great blood flow, exercises, doesn't do drugs, none of that, isn't on any medications. I'm probably going to prescribe him sex therapy plus daily low dose tadalafil, or the generic for Cialis. Why do I do both? Because I want to get him back on the back confident again. And so the medicine's going to make him feel confident, and the sex therapy is going to do the real fundamental work. Then maybe in like 6 months, he doesn't feel like he needs the medication anymore. Okay. So pills, both on demand or daily, when pills don't work, or if patients want to try, when pills don't work, we usually will move on to either injections that people will learn how to do in their penis. It sounds horrible, but it's actually quite easy. But you can inject your penis with a medicine that gets you hard in 15 minutes. Okay. Mm-hmm. Or there are vacuum erectile devices that siphon blood by creating negative pressure, that siphon blood to the penis. There's a procedure, the penile prosthesis that I referred to, which is a surgical implant that helps to get a pump up a firm penis. There are all of these things have been around forever, and they're completely, well known to urologists, but there are newer restorative options, restoring blood flow. Wouldn't that be nice if like, hey, let's do this, and now you don't have to take any medicine or pump up your penis or give yourself an injection. There are newer restorative options that are promising, and for the mild to moderate cases can help. Okay, we can take a man that's on pills to no pills, okay, and getting erections. We can take a man who's maybe starting to lose the effectiveness of pills to now the pills work. And that's referring to some stuff like shockwave therapy, low intensity shockwave therapy, and to some degree PRP or platelet rich plasma therapy. For premature ejaculators, we don't have any FDA approved methods or pills for them. Okay, there's no FDA approved premature ejaculation medicine, but we use off-label things. Okay, so one thing we may do is like numbing spray. Okay, that kind of decreases sensation. And so if you have less sensation, then you have you need a greater threshold to get to the peak of the top of the mountain. All right. And there's numbing sprays that are there that don't numb your partner too. All right. We can prescribe SSRIs. SSRIs are the most common antidepressants. And we know if anybody who's on an SSRI that has a penis may attest to, God, it's harder to ejaculate. It's harder to get to an orgasm. It's a very common side effect. And so give somebody who premature ejaculates an SSRI, well, now they can go longer, right? Because it delays that orgasm. So those are examples. The other thing are behavioral things. Again, premature ejaculators also get recommended for sex therapy. We may be able to have like behavioral tactics like, okay, breathe slowly, pause and hold, other different kind of behavioral things to try to delay orgasm.
It's amazing. Thank you
Yeah.
so much. That was like a master
Yep.
class in urology,
That was-
right? Of like premature ejaculation and erectile dysfunction. I love it.
Yeah.
I was like absorbing all of that because it's information that is not, readily available in my brain. So for me to hear it, and it never hurts to hear it because, I don't have all those solutions that you do because you're a
Mhm.
urologist and I don't deal with men really at
Mhm.
all. So most of my patients are women. So
Yeah,
as a
yeah.
gynecologist, but that's fantastic. I love it. So tell me what keeps you going? What motivates you to keep going and keep seeing patients daily? And what is your big why?
Oh gosh, that's a great question. So, two big like whys. Number one on the patient side of things, you know, um, it's really beautiful when a patient has struggled to do something that we all take for granted, for instance, like, having sex, or not wearing or being able to wear clothes and not have to be in a depends or pads.
Yeah.
Okay. And that I get to do something that affects that seems little and like, oh, I'm not curing cancer, but I'm impacting their freaking everyday life, right?
Of
I
course.
had a
Of course.
patient crying after a procedure I did on her bladder. And I was like, why are you crying? She's like, Dr. Milhouse, I get to wear underwear again.
Oh, yeah.
I haven't felt the feeling of just underwear on my
Yeah.
skin. It's always
Yeah.
been this depends, wet depends,
Of course. Of
and
course.
she was just crying. I had a
Yeah.
patient who had terrible pain with penetration for years, 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 had given up on dating,
Mhm.
okay, and saw me, and I did a procedure, vestibulectomy and perineoplasty, and saw her, and I will never forget, like, after she recovered, she's like Dr. Milhouse, I used a vibrator
Oh,
and it didn't hurt and it kind of felt good. And I mean, this is a woman who hadn't felt good in 10 years. And I was like, and she said something so funny to me. She goes, my wish and goal, my goal, Dr. Milhouse, is the next time you see me, you have to treat me for chlamydia because I've been a terrible whore.
it's
Like I got 10
amazing.
years to make
That-
up for.
That's right. That's right. Yeah, that she just can't
I
stop. That's
died.
awesome.
I
I love
loved
it.
it for her. Yeah,
Love
she was
it.
so happy. So like that,
Yeah.
I mean, what did that motivate you? Like, oh my
Yeah,
goodness.
absolutely. Absolutely.
So
That's
so
awesome.
that is on the patient side. On the kind of outreach side of things, I am unapologetically a Black woman. Okay. And that is what I am first and foremost. Okay.
Love it. Yeah.
And I recognize that I am in this very male dominated, very non on not diverse field. We're changing. We're slowly getting there. And so I feel obligated, and not like not in a negative way. I feel obligated to whom much is given, much is required. Okay.
Yeah.
Feel
Absolutely.
obligated to be a visible face, voice for others that may say, I don't feel like I fit into this. I don't see things that look like me or feel like me. Okay.
Yep.
And
Mhm.
so I have to be out there for not only my community, but any other community. Just like you said, when you were interviewing for residency, and oh my God, you saw this program director, this Black woman who was like fiercely, proud and independent and nurturing, and it resonated with you.
Yeah.
Every urology match, I get at least one or two random messages in my DMs. Hi, Dr. Milhouse. You don't know me, but I'm da 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 da, a Black woman. I am a queer woman. I am a brown woman. I am a blah blah blah. And you introduced urology to me, and I thank you for being yourself because it made me feel like I could do this too. And I just want to,
Seen and heard.
I
Yeah.
matched in urology. Every match, I get something like that. And that is the best. That is
Yeah.
the best.
That's amazing. I love that. I love that for you and for them, right? To be able to be that vision board for somebody else, right? To see themselves in you and to aspire to that. I mean, that is so fantastic and I love that. So, as we start to kind of finish up this podcast, I love for you to give three pearls that you would give to somebody listening and watching this, and the three things that you think is so important regarding maybe urology or whatever you think is important in your field.
Okay. Number one pearl is vaginal estrogen is
Yeah.
necessary
Yeah. Life
for
changing,
all
right?
vulvas at
Yeah.
some point. You will
Right.
need it. It just should be preventative medicine, in my opinion. It should be
Yeah.
preventative medicine.
Yeah.
Like
Picture.
like we talk about sunscreen for our face. Everybody got to use it. Every vulva got to use it. Okay.
Yeah.
That's number one. Like it would be like a preventative thing by like age 45. Oh, you're not on vaginal estrogen? Here you go. And it'd be over the counter. Number two, that you don't have to live the way you're living. Please. We accept a lot of like low quality of life crap, and we do not need to do that. Okay. All right. You can have like the stuff that feels like, well, it's normal. It's everybody's like, well, isn't it normal? It's not normal. It's common, but it's not normal. Okay. And so please, um, invest in your life and in yourself. Okay. You don't have to live like that. You don't have to live wet and in pads. You don't have to live with no with pain with sex. Like that's not acceptable. You don't have to live with um, the lack of intimacy, with lack of erections. You can do something about it. And the third pearl, oh goodness, there's like so many like little things. The third one is that urologists do a bunch of things that you didn't like, that we are not just, prostates. We're not just people who take out prostates. Okay. We're not just people who look at penises. Like, I want to do a series like urologists do this. Like, we do a lot of different things. Okay. One of like we talked about, I'm a urologist who does female sexual dysfunction. I'm a urologist who does hormone therapy, menopause care. Okay. Urology is for everyone.
I love it.
Urology is for everyone. It
Yeah.
is truly for everyone. Okay.
Yeah, that's right. For all those in the back that didn't hear you.
Urology is for everyone.
That's right. That's right. I love it. Yeah, that's
Yeah.
so fantastic. I love everything about this episode. It was so fantastic. So much value in this. So thank you so much for
Thank
coming
you.
on and for all those people listening and watching and saying like, wow, she is so fantastic. I love her so much. And I'd love for her to be my urologist. How can they get in touch with you?
I would love to be your urologist. I'm your favorite urologist,
That's right.
affectionately.
You are my favorite urologist. Yes, I love
Yes.
that.
Yes. They can, first of all, if you do want to see me in my practice, whether virtually or in person, go to downthereurology.com. It's so easy to remember. Downthereurology.com. That is the name of my practice. I'm very proud of it. I am 50% owner. It is 100% physician owned and operated. And we're based in Chicago, but I can see out of state patients virtually. The other thing is you just want to connect with me and see what I'm yapping about on this here internet. Two main platforms that I'm on: Instagram at Dr. Milhouse, and Milhouse is with one L. So Milhouse. If you just search your favorite urologist in Instagram,
Right.
you're gonna find me.
The kind of
And then
urologist dancing, shaking her booty. That would be
yeah. Put like urologist dancing. I don't
yeah.
know. Cool urologist. Like
That's right. That's her. That's
yes,
her.
black urologist, whatever you want to do. And then YouTube. Um, I'm on YouTube because I think YouTube is a great platform. I don't have a podcast. I'm like a video person. And so YouTube is my like long outlet. And I have a channel at Down There Urology. Okay, so the name of my
Okay.
practice is the name of my YouTube channel.
Awesome.
Mhm.
So if you haven't subscribed, you need to subscribe to Dr. Fenwa Milhouse's YouTube and
Yes,
Instagram. That's right. Absolutely. All right. Well, thank you so much for coming on and
thank
telling
you.
us all these pearls. I loved our whole conversation, and I can't wait to see you in person again. We met at Ishwish, and
Yes.
hopefully I'll get a chance to see you. I don't know if you're going to the Menopause Society or any of those conferences, but
Yeah,
um,
I plan on. I need to get on it because last year Menopause Society sold out.
it did sell out. It did sell out. You think it was like a Kendrick Lamar concert or something, right?
Yes,
Like those tickets
someone
just got sold out.
I needs to get on it.
That's right. That's right.
I'm
Yeah,
one of
you
those
need to.
people who registers like a month or two before. So
Yeah, yeah,
this
yeah.
is, I'm not new to this whole sold out business.
You're,
Yeah.
you're going to have to start scalping. There'll be those
Yes.
people outside of the Menopause Society conference, right? They'll
Yeah.
ask you, "You want a ticket? Looking for a ticket?" Yeah, that's definitely it.
Yes. Yep.
All right, very good. Well, we are done here, and it's been real and really
Thank
intimate.
you.
And of course, it's not meant to be any type of medical advice. If you have any questions about your health or urology or anything, make sure you go see your healthcare provider. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.